I would like to speak to you about the evaluation of an animal health program that has been running annually in the Canadian North since 2008. There are 3 territories in Canada's north: the Yukon, the Northwest Territories, and Nunavut. This region is vast and sparsely populated, making up over 1/3 of Canada's landmass, but home to just 0.3% of the population. Indigenous peoples make up the highest proportion of the population in this region compared to the Canadian provinces to the south. The history with dogs in northern Canada predates Canada as a country. Indigenous peoples kept dogs for centuries before European colonization. Dogs had various uses, including for transportation, draft work, and as hunting partners and protectors. Today, dogs in northern Canada are still used in these roles and are also companions. Today, I will focus on one region in the Northwest Territories called the Sawtooth Settlement Area, a Dene and Métis land claim area consisting of 5 permanent communities. The area is more than 41,000 square kilometers, which is roughly the size of Switzerland. Temperatures in the Sawtooth range from plus 25 degrees Celsius in the summer to minus 50 degrees Celsius in the winter, which impacts many activities. Like other communities in northern Canada, the Sawtooth communities are very remote, only accessible by plane for much of the year, except for a few months in the winter when a winter road is open. This means there is limited access to veterinary services. The closest permanent veterinary clinics to the Sawtooth communities are in the territorial capital of Yellowknife, a more than 1,000-kilometer drive or a few $1,000 plane ride away. The 5 Sawtooth communities vary in size from 159 to nearly 800 people. This presentation will focus on the 4 smaller Sawtooth communities because the largest community is socioeconomically and demographically different from the other communities, and more than 60% of its population is non-Indigenous. The population of the remaining 4 communities is more than 90% Indigenous. Unemployment rates of more than 22% and average annual incomes half the Canadian average, along with high cost of living at 1.8 times that of living in a large city in the province to the south, result in poverty and no expendable income, and contribute to barriers to accessing veterinary care. Subsistence hunting, fishing, and trapping activities are practiced by more than half of residents in these communities. Co-author Susan Coutts had been working with the Sawtooth communities for several years on the implementation of a wildlife disease monitoring program when in 2007, community members raised concerns about dogs in their communities. Concerns included dogs becoming sick with diseases like parvovirus and having no means to help them, like this puppy on the left, and dogs being exposed to potentially rabid wildlife, like through interactions with Arctic fox, pictured on the right, who are seen in the communities and are the primary host for rabies virus in the Arctic. The clinics began with a needs assessment in 2008 to determine the acceptance of and needs for vet services in the region. The assessment involved community questionnaires distributed at the schools and at the veterinary clinic event offered that year. The assessment revealed concerns for animal welfare and public health. Community members reported there being too many dogs, which at times were regulated through dog shoot days. These events were the only mechanism for dog population management in the face of public health risks, and were described as having significant mental health impacts on people, including impacting the retention of teachers in the local schools. Children commonly described being bitten or chased by dogs, and interactions between dogs and wildlife occurred often, with concerns for rabies transmission. There were low rabies vaccination rates and dewormer use, few dogs had been sterilized, and more than half the dogs seen at the clinic event were in less than ideal body condition. As a result, these vet clinics have run annually each February since as the Northern Community Health Rotation. The program was developed with the concept of One Health in mind and involves 4 final year veterinary students, volunteer vets, and faculty and staff from the University of Calgary Faculty of Veterinary Medicine, who travel to the region and drive the winter roads serving each community. It was developed as a partnership between the University of Calgary, the Sawtooth communities, and the Government of the Northwest Territories. Vet services for dogs are provided in each community and include vaccination, deworming, and sterilization surgery. Education about zoonotic diseases and dog bite prevention is provided to clients, as well as to youth through the local schools. Youth engagement is a key component of the program, and youth are encouraged to volunteer at the clinics and to observe clinic activities. Anecdotally, team members have described that since the start of the program, dogs appear healthier and are living longer, and there are fewer free-roaming dogs. Community members also report fewer dog shoot days. As a veterinary student clinical rotation, it's extremely popular and receives very positive feedback from students and volunteers each year. So, in 2016, we decided to start a program evaluation to understand what the impact of the program is. Going into the evaluation, we knew that there were many factors that impact dog health in these communities, not just access to veterinary services, but also the physical environment, the biology of dogs that live in the area, the behavior and social factors that impact dog population dynamics and interactions between animals, and human socioeconomic factors. As such, we wanted to take a One Health approach to our evaluation and understand how the program was impacting each of the following stakeholder groups: the dogs, the communities, and the vet service providers. Our objectives were to understand the impacts of more than a decade of once annual subsidized services on dog health and welfare, on community concerns about dogs, and to understand the experiences of vet service providers who deliver the services to address the long-term sustainability of delivering services in remote communities. Our methods of evaluation were guided by the findings of a scoping review we completed about how preventive veterinary programs are evaluated. Our review highlighted that long-running programs like the Northern Community Health Rotation are not often evaluated for their impact on all stakeholders. Many of the methods of evaluation, indicators, and impacts assessed aligned with those used by others, including the recommendations made in this guide from the ICAM Coalition. With this information in mind and to meet our objectives for the program evaluation, we did a dog census in 2017 using observations and community questionnaires, a medical record analysis looking for changes in 7 measures of dog health and welfare over the period of 2008 through 2018, a door-to-door household questionnaire with community members in 2017, similar to the 2008 needs assessment, and an online questionnaire with vet service providers involved in the program between 2015 and 2021. Community consultation and approval for the project was sought prior to starting, and results were presented back to the communities for their feedback. Now I'll discuss what we found. The results relating to the dogs and communities will be presented as a mix of all 3 data collection methods used, but these 3 symbols will be displayed on each subsequent slide to indicate which data source the results are from. In addition, the 4 communities have been anonymized as communities A to D throughout. The household questionnaires in 2017 described 51% of the dogs in the communities. The number of dogs per community varied from 40 to 89, and the percent of households with dogs varied from 18 to 66%. Overall, there were 1.6 dogs per dog-owning household. These numbers may seem quite low compared to in other places. Unfortunately, we do not have a dog census from the start of the program in 2008 to compare them to. But when we looked at the number of owners and dogs seen over time, we saw an increase until about 2013 and then a plateauing. This suggests an increase in clinic uptake and then may reflect a saturation in the need for services. This was corroborated in our record analysis, where we found that we were more likely to see repeat dogs at the clinic events as time went on. To assess program reach, we used the 2017 dog census as the denominator of the 2017 clinic reach, and we found that we saw between 48 and 83% of dogs with an overall reach of 67% in 2017. Focusing now on the dog health and welfare measures we assessed, we found a significant increase in the median age of dogs described in the 2017 questionnaires compared to the 2008, as well as a significant increase in the mean age of dogs over time in the record analysis. Overall, this could indicate that dogs are living longer and that there are fewer puppies in the communities. We did not, however, find a significant change in the sex ratio of dogs described in the 2 sets of questionnaires, with it remaining consistently skewed towards male dogs. This finding was consistent with the record analysis, where we also found the male-skewed sex ratio did not change over time. This skew towards male dogs is evident in the graphical display of record data by year, focusing on a dog's sterilization status on entry into the clinic. In this graph, females are in orange and males are in blue, and sterilized animals are in solid colors and intact animals are in hatched colors. It is also evident in this graph that sterilization increased over time, a finding confirmed by our record analysis. We also found a difference in the uptake of sterilization by sex, with more female dogs being spayed than male dogs being neutered. But we found a difference in the uptake of sterilization by community, with more dogs being sterilized over time in communities A, B, and D compared to community C. This could be for a number of reasons, including the cultural acceptability of the procedure in this community. With regards to body condition, we found that dogs were more likely to enter the clinic in ideal body condition as time went on, with a significant association between body condition and the dog's sterilization status. As time went on, sterilized dogs were more likely to be seen in ideal body condition than thin body condition, and in overweight body condition compared to ideal body condition. Finally, with regards to vaccination and deworming, there was a significant increase in the proportion of dogs described in the 2017 questionnaires as having received preventive care compared to in 2008. This was corroborated in our record analysis, where we found an increase in dogs being up to date on vaccines over time, with no community differences found, unlike with the uptake of sterilization. With regards to rabies vaccination in particular, the program reached numbers that I outlined earlier are a good reflection of the minimum rabies vaccination coverage in the communities, as all dogs seen at the clinics of sufficient age are vaccinated for rabies. In the household questionnaires, participants were asked what the role of their dog was. Companionship was the predominant purpose across communities in 2017, and 90% of dog owners also strongly agreed with the statement, "My dog is part of my family." The questionnaire also asked people if they had been chased or frightened by a dog, knocked over by a dog, or bitten by a dog. The most common negative encounter in 2017 was still being chased or frightened, with 22% of respondents answering yes. The finding of few people being bitten in 2017 is corroborated by a Government of the Northwest Territories report that found that the Sahtu region had the lowest rate of reported dog bites after the capital city of Yellowknife between 2011 and 2016. As was done with the questionnaire results in 2008, in 2017 an analysis was done on the questions about attitudes towards dogs to assign an overall positive or negative score. We found that in 2017, 77% of questionnaire respondents had an overall positive attitude towards dogs compared to 62% in 2008. An analysis of other questions for differences between 2008 and 2017 responses revealed significant changes in one question in particular: "There are too many dogs in my community," with fewer participants agreeing with this statement and more disagreeing compared to in 2008. Finally, the analysis of questions about ongoing concerns with dogs and how concerns had changed over time revealed that there were still some concerns being discussed. Loose dogs were raised as the predominant concern, and people described loose dogs as dangers or nuisances or strays. Some people argued that dogs were not the issue, the people were. They felt that some people did not take care of their dogs or needed to tie up their dogs more. Other people described having concerns with the way problem dogs were dealt with in their community. However, respondents across communities described improvements in concerns about dogs. People described changes that were physically seen, like fewer loose dogs and fewer puppies, increased access to options to deal with problem dogs, changes to animal welfare and the value of dogs, and finally, a decrease in the fear of dogs, with people not being afraid to walk in their community. Lastly, I will highlight some of the veterinary service provider experiences. Participants described having an overall very positive experience delivering services. In particular, veterinary student participants felt welcomed and supported by the communities they served, and well supported by and connected with the members of the veterinary team. One vet student said the experience was about not only offering vet services, but spending time in homes of community members, having bannock and sipping tea, eating caribou jerky, and listening to community members. The experience also helped vet students develop cultural humility through gaining confidence in meaningful interactions, acquiring a client-centered approach, and challenging preconceived biases, all of which can improve access to care through improving trust in vet service providers. This was demonstrated in the following quote: "The Northern Community Health Rotation improved my technical skills, but more importantly, really helped my cultural sensitivity and has helped me overcome biases I was not aware I held." Finally, vet students, and in fact all veterinarians involved in the rotation, overwhelmingly expressed enthusiasm to participate in similar initiatives because of the importance of addressing access to care issues for remote communities. One participant said, "Yes, I would participate in a similar experience. It is so important. I truly saw so much good being done for the animals and their people." So to summarize, what were the animal, community, and vet service provider impacts of the Northern Community Health Rotation based on common impacts and indicators? From an animal health impact perspective, We found improved dog welfare through improved body condition, increased proportion accessing preventive care, and high vaccination and deworming coverage. We found improved care provided to dogs with high levels of program reach and dogs being described as family members. And we found indications of dog population stability through an increase in both the median and mean age of dogs and the proportion of sterilized dogs, in particular females. From a community impact perspective, we found a reduction in risk to public health with high rabies vaccination and deworming coverage and a reduction in dog bites. And we found an improvement in the public perception of dogs with improved attitudes towards dogs and reduced concerns about dogs in the communities. Finally, from a vet service provider impact perspective, the overall positive experience participants had with the communities and as part of the vet team, the impact on their ability to serve diverse clients through the development of cultural humility, and the enthusiasm to participate in similar initiatives have the potential to positively impact the access to care issues faced by underserved communities in remote parts of Canada. Thank you so much for your attention, and thank you to the many supporters of this program and the funders of this work. I am happy to take any questions.